Let's continue with our Medical Matters Monday edition. The Department of Health has urged the public to avoid physical contact with someone who has Mpox. This comes after an outbreak was recorded in South Africa with a total number of 7 laboratory-confirmed cases, as well as 2 deaths. Mpox is a rare viral infectious disease in humans that's caused by the monkeypox virus. And although the virus is not highly transmissible from person to person, it has increased in global public health significance and can cause a painful rash, enlarged lymph nodes, as well as fever. So for more on this discussion, as well as the variant in South Africa, we're going to be joined by Professor Tulio de Oliveira, Director of the Center for Epidemic Response and Innovation, CERI, at the University of Stellenbosch, as well as Director of KwaZulu-Natal Research, Innovation and Sequencing Platform, KRISP, that's at the University of UKZN. Prof. Tulio de Oliveira, good morning and thanks for your time with the SABC at this hour.
Yeah, good morning and good morning to all your viewers.
Prof, let's start things off. There's obviously now been a global outbreak of Mpox disease, formerly known as monkeypox. It's been ongoing since 2022. Perhaps you could speak to its origins. Has it been able to be mapped and tracked if we're looking at the variant in South Africa as well? Talk to what is occurring on that front.
Okay, thank you. Yeah, so the variant in South Africa that has been detected in 3 of the cases, so that's 3 of the 7 cases that have been sequenced, is the same variant that have caused the global outbreak since 2022. So this variant, we don't know where it have emerged, potentially somewhere in Africa, but it was really amplified, and in Europe and United States of America. So that was in the summer of 2022 after the COVID pandemic. And that was a new emergence of Mpox that started in Europe and the United States of America, especially on some key populations, such as men who have sex with men. It caused a massive outbreak, 90,000 infections, close to 500 deaths there. And then it seems to have been introduced potentially from there into South Africa, and that's the ones that cause the infections, or at least the ones detected.
Prof, thank you for painting that picture. I actually want to just look at what's occurring this time round, just because given that the last time South Africa recorded positive cases of Mpox was back in 2022, as I alluded to, and this was when that 5 cases were confirmed in the Western Cape, in KwaZulu-Natal, as well as Limpopo and Gauteng. So talk to us about how the 2024 outbreak differs somewhat from the previous one. Okay,
the 2024 outbreak differs because all the patients that have been diagnosed, the 7 patients, they were very sick, which normally give you as a public health scientist, you understand that when you only catch cases that are very sick, there is many more cases there, because that's the only ones that were so sick that need to be hospitalized. And unfortunately, 2 of them were so severe that died. So we have reasons to believe that the outbreak's much bigger, because the severity of the case that we have found. And we have also reasons to believe that the outbreak, it is transmitted in South Africa. Why that? Because from the 7 individuals that were detected, none of them had travel history outside the country. And some of them were connected, but many of them were not connected in the same network. So we know that there is a transmission in the country, and we know that potentially that involves both Gauteng, KwaZulu-Natal, and potentially even other provinces, because the 7th case was found in the Western Cape, but was also linked to someone that lives in Gauteng.
Prof, thank you for also touching on how the sequencing analysis of Mpox, what was revealed about its transmission as well. Because now, given what you've unearthed at this point, is the access to an Mpox vaccine? Talk about the equitable access, or the questions around that as well, coming to the fore.
Okay, so unfortunately, it is the history repeating itself. So we know that from very similar what happened with with COVID, that vaccines were less made available in some of the poorest countries in the world, or the countries that needed the most, especially in Africa. The same is happening with Mpox. So there is large stocks of vaccines, but not to best of our knowledge in Africa. And that is the third generation vaccine that has been concentrated a lot in Europe and the United States, and that was used to finish the wave of infection in 2022. So at the moment, the Department of Health and the World Health Organization is negotiating some vaccines to come to South Africa. So we didn't have that in stock here, as well as the antiviral treatment that can reduce the lesions and the symptoms. Unfortunately, we are acting after the first cases, but at least we detect that quite early, and that is very positive that our Minister of Health, when we had only 5 cases and 1 death, came in public nationally to highlight this outbreak, because if you can detect quick, then you can act, and that's what they are trying to do now with vaccines and antivirals. And of course, would be better to have that in the country, but in the second best options is early detection and early action.
Well, thank you for also speaking to the nature of the virus, whether it is preventable and treatable, and you have alluded to that now. I actually wanted to look at our preparedness as a country as well, because the Department of Health says that the multi-country Mpox outbreak is characterized by sustained human-to-human transmission, and that's via direct skin-to-skin and sexual contact. And obviously people living with HIV are also now disproportionately affected. Talk to us about how the COVID-19 pandemic perhaps better prepared the country to deal with Mpox.
So South Africa has a good surveillance system, so that allow early detection and allow early characterization. That is good. It also has what we call a number of committees. It have a national immunization committee that meet often. So I chair the Network for Genomic Surveillance in South Africa, that have multiple laboratories that can do genomic surveillance of including flu, COVID, hepatitis, HIV. So we are relatively well prepared, which is good. Of course, that this need continuous investment, which at the moment we do have from our government and international funders, And what you need is to basically have both workforce, that's training, this means respond to current epidemics, and public health that can access the therapies and vaccines. Unfortunately, we may be coming to a kind of age of epidemics, because climate change, because urbanization, because globalization, and more than ever, South Africa has to maintain the infrastructure that worked so well in the COVID pandemic to respond to other epidemics, and that is the first one that we are doing. And the main thing is to maintain the system and work together, both scientists, the National Institute of Health, and the government, together also with the WHO and Africa CDC, to make sure that we can respond quick to new outbreaks, which we are trying to do that nationally at the moment.
Prof, thank you for speaking to that. I actually wanted to touch on the point of globalization. I just want to read some of the stats as per the World Health Organization. There's obviously been a multi-country outbreak of Mpox published on the 31st of May back in 2024. And so given what's been unearthed at this point, a total of 97,208 laboratory-confirmed cases of Mpox, including 186 deaths from 117 countries in all 6 regions that were reported. I'm just painting that picture because I want to look at whether this is a worrying number given the numbers and the infections that are coming to the fore. Paint that picture for us realistically.
Okay, at the moment, we have 2 main variants of Mpox that have emerged. We have the one that's caused the global pandemic or the global epidemic that you describe with 97,000 cases in 117 countries, which peaked in 2022. That one has been characterized for transmitting in network who has men who has sex with men, which sometimes it's easy to control because it is a smaller network, and a lot of time change behavior there. It will be the main responsible for decrease the cases. But we also have a new variant that have emerged in the beginning of the year in the Democratic Republic of Congo. The DRC and Central Africa normally is endemic to Mpox, and that one is a different one. That one, it got also different names, called 1B. The current one calls the outbreak in South Africa is called 2B. And this one, the 1B, has been transmitted with women have 50% of the infections, with suggesting entering another sexual network of men and human heterosexual sex, and that was in the east of the DRC, in a mining town that has borders close to Rwanda and Uganda. We also participate in that response with colleagues from both of the DRC and international. And that variant, we worry more because it can be transmitted in heterosexual network, which is most of the population. Fortunately, it has not been detected anywhere else, only in the Democratic Republic of Congo, and have to be acted quick there. So it seemed that outbreak had decreased. And that's why it's so important to increase the surveillance, not only in South Africa, but other African countries. Because if we see the cases of variant that's highly transmitted between heterosexual networks that comprise the whole population, then it needs to be controlled very quick.
Well, Prof, I also wanted to then bring it back closer to home in a South African context. Look at the association of Mpox with HIV. Are you able to deduce anything on that front? If we're also going to look at the age groups that it affects, I mean, are children also vulnerable? Well, walk us through what's been unearthed on that front as well.
Okay, so the association between Mpox, especially disease and severity, and HIV has been well characterized during the 2022 global outbreak in Europe and the US, because most of that infections were on men who have sex with men, which it is the group in Europe and in North America that have the highest HIV rates. So we know quite well that many people can get Mpox, but if your immune system is down, normally with a lower CD4, that then the disease severity is much strong, and we have some appalling images on people that is immune suppressed, how sick they get with basic lesions everywhere, which sometimes not only externally on the skin but internally, which then make very difficult to swallow medicines. And we believe that one of the cases in South Africa also had a advanced HIV, which then Mpox become a secondary infection that end up causing the death. Very similar as we had for decades in South Africa of tuberculosis, and many viewers will remember that people normally even would say that people do not die only of HIV, they die of TB because the immune system is low, and then the new disease come, and then Mpox also take advantage of the same process. What is the guidance, especially for people that are HIV positive or do not know the status? Is to do a test, or if you know your status, make sure that you are well controlled with HIV, because what we saw is that people that may be HIV positive but is antiretroviral therapy, the immune system will be as strong as most of the HIV negative people, and this if you are with immune respond to the ARVs, one can even catch Mpox but doesn't get strong disease severity. So yesterday, the spokesperson of the Department of Health highlighted that's very important for people that are immune suppressed from HIV or from cancer, that to make sure that adhere well to treatment, because in the end, if you control the HIV, then even with infection of Mpox, the severity will be much lower.
Prof, thank you for joining us on this Medical Matters Monday edition here on the SABC, for speaking to the phenomenon at hand. Of course, we're monitoring developments as the days progress. But Professor Tulio de Oliveira, Director of the Center for Epidemic Response and Innovation at CERI at Stellenbosch University, and Director of KwaZulu-Natal Research Innovation and Sequencing Platform KRISP at the University of KwaZulu-Natal, joining us this morning to talk about the outbreak of Mpox in South Africa.